Dr. Alexander Scott, you mentioned getting the vaccine in the hands of those who need it most and make sure they're at the front of the line. The Attorney General's office said yesterday that they're looking into the vaccine distribution at Lifespan and Care New England and the Department of Health Oversight, apparently concerned about who in the hospital system was getting the vaccine, whether it's board members or people who are not working on the front lines. How do you assure people that the right people are getting the vaccine and maybe there aren't questionable steps being skipped and people are line jumping, as there is bound to be concerns about?
Yeah, first I'll say from the hospital's standpoint, generally the hospitals have been very good partners throughout this response in helping to ensure not only their staff but others outside of the hospital community are vaccinated. One of the aims of phase 1 of the vaccination campaign has been to protect our hospital infrastructure so emergency care is available when people need it. For that reason, the hospitals are being allocated vaccine to vaccinate throughout their organizations incrementally. They were told to vaccinate their highest exposure healthcare workers first. Other people throughout hospitals are also getting vaccinated after them because even though they may not be actually patient-facing, they are part of what makes a hospital function. So our social workers, laboratory staff, administrators, custodians, IT professionals, dietitians have been included in the mix of those within the hospital system to get vaccinated. As the hospitals have moved into vaccinating their non-clinical staff, we have been able to work with them to shift to vaccinate more of the outpatient providers who are clinical staff outside of their systems as well. So there is an ability to be dynamic with this. We leave it up to the hospital to determine that individual that is in, but are working closely with them to ensure that those who are most clinically facing, those who are at highest risk, continue to stay at the forefront of who's vaccinated, and they're able to take care of the non-clinical facing ones that also contribute to the hospital functioning.
Do you have a concern about how it looks, though, when people who are not dealing with patients or on the front lines are getting the vaccine before people who are 65 or 75 years or older?
I definitely understand the optics concern that exists. We do know that those individuals not directly interfacing with patients still do contribute to the hospital functioning well and effectively. And with that, we also know that those who are out in the community continuing to face patients need to get access to the vaccine. And as I shared earlier last week, really because of this partnership with hospitals, we were able to accelerate vaccinating outpatient providers through the hospital mechanism because of that. And the hospitals continue to tell us we are eager to do more and to vaccinate outside of their system, knowing that it is a ready-made logistics to a ready-made logistical approach to getting many people vaccinated. So I am comfortable now overall with where that is, given the broad number of people we've been able to get vaccinated quickly through that system.
Director, what penalties, though, do you think the health department should establish for people who jump the line or for hospitals that don't follow your guidelines?
So it is an interesting balance. We have made clear the message to hospitals, to all of our vaccinating partners, the importance of keeping equity at the forefront, the importance of focusing on those who are at highest risk, and have made clear the ability to change course if we need to because of concern that those vaccinating entities are not following our guidance. When we have overall partners who are working with us, who are making sure that the broader number of individuals that need to get vaccinated are getting vaccinated, we don't have a need to, penalize, but we continue to keep at the forefront if there's ongoing concern and there are numbers of people that are getting skipped inappropriately in spite of our messaging, we can absolutely make the changes that we need to make to address that.
Dr. Chan, a few weeks ago we had a conversation right after, it was one of the vaccine briefings on Zoom or Facebook, whatever it was. There were some people who were complaining about Dr. Finale, Care New England CEO, receiving a vaccine. And it was sort of celebrated as, hey, look, he said he's doing this to set an example, set a tone for the hospital as a whole. Looking back on that now, is that sort of tone-setting mechanic something that other organizations should avoid? In other words, prioritizing people who are on the front lines?
Yeah, it's a great question. I think what we've tried to do during this pandemic is strike a balance. I think, per what I talked about, there's a number of myths circulating. And what best example can one give about getting the vaccine than to get it themselves? So I think Dr. Finale, others in the community have tried to make an example. And I think there's a case to be made for people who are very visible members of the community to get that vaccine, to show that they believe in it, to show that it's safe, et cetera. So it's a balance, but of course we need to prioritize the groups that we've talked about.
Mr. Smiley? As we all know, Twin River Bally's maintains a monopoly on the management of in-person casino gaming in Rhode Island. As such, they are the hiring agent for employees at state-owned facilities, Twin River and Tiverton. These casinos represent one of the top revenue sources for the state. I've had an opportunity to discuss working conditions at each casino, both in person as well as virtually. I've visited the casinos. A one-hour interview with a current employee can be found on our site at Facebook, the Coalition Radio. To wit, casino chips are freely exchanged between casino patrons and employees, ungloved, at will, uncleaned, throughout the entire day. Used Kentucky Fried Chicken wipes from a closed KFC, incredibly enough, have been used as sanitary wipes. The availability of drinking water for employees is extremely limited. Despite the presence of plexiglass borders, social distancing is at best uneven. The halls of Twin River often resemble a busy shopping mall to this day. Employees allege that little or no information is shared about in-house COVID cases to employees or to the public, that in fact the restaurant opening was delayed due to a non-reported COVID situation. Critically, casino dealers, despite assurances to the contrary, have been informed that they will no longer be eligible for health insurance, even for those who meet their previously announced 30-hour week. Yes, there is a point. These dealers are paid a sub-minimum wage and rely largely on tips. This despite the acquisition mode Twin River is in. Here's the question. At this moment, the state of Rhode Island is asking casino employees to work in unsafe, unsanitary conditions without health care insurance. There's an element of hypocrisy here, as privately owned businesses must adhere to far more rigid rules, including penalties for health insurance. What will the administration do to protect casino workers?
So I'm not aware of Twin River or Bally's, as it's now known, being exempt from any employment regulations, and neither are they exempt from any COVID regulations. If there are allegations of violations of COVID safety protocols, then the Department of Business Regulations will inspect. And if employees feel like they're being treated improperly, then they have recourse like any other employees in Rhode Island. Having said that, they've been good partners. As far as we know, they have not been a vector of spread, and we appreciate their cooperation and collaboration to operate at a limited capacity in a safe manner that has been allowed to operate and actually continue to provide employment opportunities for quite a few Rhode Islanders.
What type of measures and how often are they being inspected, say, relative to the level of inspections at privately owned organizations?
I'd have to get back to you on the frequency of the inspections, but they are not exempt from, nor are they held to a different standard than we hold any other operating businesses along the existing COVID protocols.
Can we expect some type of intervention, since it is a state-owned facility, a state-owned business? This company, Twin River, is acting as a management agent, all right, on behalf of employees there to achieve some level of safety, and/or, as you know, as the state promulgated this week, in the absence of health insurance, there will be fines.
You can expect them to be held accountable and held to the same standard that every other business is being held to, and that if they're in fact not meeting the protocols that are required by the Department of Business Regulations, the Department of Health, then they'll be given an opportunity to correct those violations, just like any other business. But again, I have no knowledge of or evidence that they're in fact violating those provisions or protocols.
Some states, or any of you, some states have advanced the proposition of trying to go out on the market on their own with the vaccine manufacturers to try to obtain vaccine. The Biden administration has put the kibosh on this. Is Rhode Island among them? I mean, is there anything you can do, the state can do, to get more vaccine here.
Yeah, any potential opportunities that we've had to obtain additional vaccine, you can, know for sure that Rhode Island has explored. The conversations that we've had have resulted in where we are with having the amount of vaccine supply that we have. We certainly want to work with the administration, who is committed to ensuring that all states get access to the additional vaccine that's needed. So we're going to continue moving forward in that realm. We hope that there will be. There are additional vaccines that are being manufactured, and the Biden administration has been working hard to be ready to accelerate what's needed. There's full pressure nationwide for that to happen. We are ready for when that occurs.
Someone who participates in a vaccine trial, one of the new potentials, are they removed from the list of someone who received one of the Pfizer or Moderna vaccines?
We would work closely with the individuals if we know about it. There aren't any different exceptions that are done at this point in time, but if we have additional information that allows us to proceed in a way that's adjusted to what they did as part of the vaccine trial, appreciating their service for doing that, then we can make those adjustments. But as of now, things would continue forward.
I know you said plans are underway for the next phase and they're going to be introduced tomorrow. Can you give some insight onto who will be prioritized in the next phase and when you see it starting?
Yeah, so great question. It's exciting that we're almost done planning for phase 2. I'm going to say that we'll hold details for next week. We're going to get some insights from our vaccine subcommittee. We've taken into account the CDC guidelines, which weigh in on this. So stay tuned. More next week by Monday or Tuesday.
Dr. Chan, the greatest pushback is coming for not starting with 65 and older. You mentioned the other states are seeing some confusion, but is there a way to kind of start even older and say, all right, we'll start with 85 plus, or we'll start with 80 plus, and then work it back that way to at least get more vaccine into more vulnerable people?
Yeah, it's a great question. That's actually exactly what we're doing, right? So even in our phase 1B, part of phase 1 prioritization, we're starting with people age 75 years old and older. So we are prioritizing 65 years of age and older, but we're starting with those 75, given that they really do have the highest risk of dying.
Even sooner? I know, again, people are still pointing to other states that have started to do that.
Yeah, so again, they should be prioritized in phase 2. And if you look at what's happened in other states that have done it, I mean, they've opened it up. Some have used lottery systems, first come, first serve. It's created these really unsafe situations, in my opinion, long lines, overcrowding, and that's exactly what we're trying to avoid as part of the pandemic, obviously.
How do you account for the decline in the positivity rate? Is it just the passage of the holidays? And, it's been a few weeks since the Christmas and New Year's holidays, and is that why the rates are falling off?
The decline in the positivity rate is as a result of a compilation of all of the tremendous work that we have put into this happening. It's exactly the direction that we've wanted to go. It's a huge credit to Governor Raimondo and her leadership and the entire team that has worked tremendously. We talked about the pause and what we hoped to achieve with that. We've told you all about expanded testing and how we want to continue to really drive that forward, the importance of treatment. The vaccine is slowly starting to be administered in an effective way to address hospitalizations and positivity rate, and people are listening. You're hearing, you're understanding. We're encouraging you to take advantage of the systems that we have built so that we can see this. There were 20,000 people tested yesterday. We want those numbers to continue, and that's how we'll continue to see the positivity rate go in the direction we want.
When do you consider or anticipate considering easing some of the restrictions that are currently in place?
For right now, we want to continue what's needed because we are well positioned to be ready for the novel strain of COVID-19 the UK strain, as it's been referred to publicly. It's increasingly more transmissible than the current strain that's in place, and we know it's in our neighboring states, as I said earlier. So where we are now, the systems that we want to continue to advance in terms of our testing, making sure everyone accesses treatment who has it available to them, and as much vaccine as we get, we push out. That positions us for handling the new strain. We also need to prepare for colleges and universities coming back, where thousands of additional young adults who are ready to behave responsibly and work in partnership with us also is another factor. So we want to keep things as they are, get through these next several weeks, and then in the next 3 weeks we can come back and assess how we have done and what could be next steps, where we can leverage the additional testing that we're doing to help us with the restrictions.
High school basketball impacting the numbers?
So sports in general is something that we have to proceed carefully with, and with a huge thank you to Director Janet Coit and the entire team and environmental management, really just showing how much of a whole of government response we have had. We have a very thoughtful and comprehensive approach in place with our sports response, basketball included. It really hasn't been just one sport over another. We, can sporadically see cases across the board. So having the mitigation steps in place are key, while balancing it with understanding that, particularly for our youth, sports allows for physical activity, emotional wellness, getting together in a safe manner, in a way that's healthy for our youth. So we want to strike that balance, but make sure that we're doing it safely. I'm not more concerned about basketball than I am about the other sports.
The difference between basketball and, say, wrestling, which is not permitted. I mean, both sports, you're making contact with another person for an extended period of time inside a closed facility. I mean, why basketball and not wrestling?
It's more so the proportion of that extended time frame with the one individual that is occurring time and time again, as opposed to basketball, where it's a little bit faster moving, a little bit more spread out. There are national standards that are in place that help describe what has led to the categorization, and we can certainly share that to explain further.
On that, if I may, just for municipalities that have taken basketball hoops out of tennis courts or other public spaces, certainly Newport is one example of that. Would you recommend they reinstall those basketball hoops?
We'll work with them. We want to have sports be an option that's safe, particularly for our youth, given the physical benefits, the emotional wellness, but want to also do it in a way that does not present more risk. So we would want to work with those municipalities in taking an approach that's best.
Have you spoken to the hospitals at all about the negative optics, as you mentioned, about board members getting vaccines? And does the department plan any changes on its rollout based on the concerns of the Attorney General?
Yes, we have spoken. We do that regularly, and the changes are what I described earlier. It's being able to make the adjustments, which we're doing regardless. As you're getting to more low-risk individuals who are helping the hospital function but aren't having the same patient interaction as some of our outpatient providers, primary care, dentists, behavioral health care providers. The hospitals have been ready to pause on what they are doing to be able to help start earlier the outpatient provider vaccination. And that's key, the ability to be dynamic, to make the adjustment that's needed, and to continue to push forward until all those who are at highest risk get vaccinated.
To follow up on that, if I might. So when the Attorney General comes to you as a source of expertise when it comes to who in the hospital can and shouldn't get, you're going to say everything's fine, that it's all good, they're all good to get a shot?
We're going to be happy to provide any information that the Attorney General would like, and it will include the specific guidance that we have said of focusing on those who are at highest risk, making sure that we keep a lens of equity in place as we're doing that, as well as taking advantage of the hospital's ability to vaccinate large numbers of people quickly in a way that's most effective.
Thank you. Doctor, in regards to some cities and towns, Cranston and Providence are considering resolutions asking the state to lift curfew on businesses. We're seeing in North Providence a business refusing to close down. Any plans to do so? What's your message there?
Similar to what I answered previously, we are at a solid place right now. We wouldn't want to make changes too early that would put all businesses at risk, particularly with the new strain in place, particularly with thousands of young adults returning to our state. We want to really ensure that we're going in the right direction and it's consistent. And when we come back in about the next 3 weeks or so, we'll be able to really make that assessment of how we can balance restrictions with the expanded testing and improved systems that we're continually working on to move forward.
Do you expect another surge? The numbers are going down, the hospitalizations are going down. Do you expect, if the new strain does show up, and as you said, college students coming back, that those numbers are just going to shoot back up again?
It's absolutely possible. You know, with this pandemic, we have seen anything is possible. We are confident in the systems that we have in place. We've worked extremely hard. I had an excellent call with all of the institutes of higher ed presidents just before this press conference. We know what is needed and have the operations and systems in place to respond, and then we just have to see how it plays out. Hope that we can continue to achieve our goal of keeping people out of the hospital, protecting our health care capacity system, preventing deaths, and encouraging everyone to do what you need to do to protect your household. Those strategies are working, and we hope that it will help us withstand what is left to come through the remainder of this pandemic.